Well, hello everybody. My name is Roy Cohen. I'll be hosting this week's Community Forum show, which I hope you'll find helpful. Welcome to a very special guest, Dr. Glenn Dodes. He's the owner and CEO of both Chiropractic Healthcare in Canton and Spinal Rehab Group in Easton, Boston, and Chelsea. He received his doctorate in 1994 from the National College of Chiropractic. He was named valedictorian and the Clinical Achievement Award winner for clinical excellence during his internship. He has received numerous academic awards, including All-American Scholar, Phi Kappa Pi, and did I mention that right?
Phi Kappa Phi.
Okay. Sorry about that.
That's
Phi
all right.
Kappa Phi, and the Certificate of Merit for Academic Excellence. Dr. Dodes received his Bachelor's of Science degree from the University of Massachusetts at Amherst. In addition, he's been active in clinical practice in Massachusetts since 1994. In 2016, he was appointed by Governor Charlie Baker to the Massachusetts Board of Chiropractors, and he has served as the chairman of the board since 2018. He's been called as an expert witness in numerous court cases, and he has lectured numerously at the Massachusetts and Rhode Island insurance companies regarding chiropractic care. Long introduction.
Sure was.
Welcome to the show.
Good to be here. Thank you.
It still have that strong grip, which I have honestly felt for years. Excellent work. Let's start off by telling the people who are watching a little bit about yourself and your practice, if we could.
Sure. I'm originally from Connecticut, grew up in southern Connecticut outside New Haven, and I moved up to Massachusetts back in 1986. I have lived in Massachusetts continuously since then, with the exception of the period of time that I was out in Chicago for graduate school. Mm-hmm. Married to my wonderful wife Lisa for 30 years.
Wow.
Yeah, 30 years. And
you're catching up to me.
We have three wonderful children, Michelle, Nicole, and Austin, all who are grown. Austin still is in college, but Michelle and Nicole are grown and out of the house. And we have the most wonderful dog in the world, Sophie, the love of my life.
Don't let your wife hear that.
Yeah, don't let my wife hear that. And I started my practice. I graduated from chiropractic school in 1994. I briefly worked for a chiropractor in Holliston as an associate for a short period of time. And then in 1995, I opened my office in Canton in Cobb's Corner and have been practicing there continuously for 24 and a half years now. Then after growing that practice, I opened a second office in Boston in 2010 and have been fortunate enough to have grown those practices to have 5 offices, including Easton, Chelsea, a second office in Boston, and obviously the Cobb Corner office.
Wow.
Yeah.
There's a point in life when you became interested in chiropractic care. Were you pursuing a different level of education, or did you do that right at the beginning?
I always knew that I wanted to be a doctor from when I was very young. I think my mother instilled it in me when I was 5. She said, "You're going to be a doctor someday." And so I always knew that I would be a doctor. I wasn't sure what type of doctor I was going to be. And then I was exposed to chiropractic kind of randomly. My father had a serious back condition where he had ruptured a disc in his back and was told by his medical doctors that he needed surgery. He was going to be on his back for 6 months and out of work, which would have been a really significant hardship to our family at that time for him to be out of work for 6 months. He ended up seeing a local chiropractor, and within 2 weeks he was completely back to normal, didn't miss a beat, and I was amazed at how quickly he was able to recover from what the medical doctors had told him was going to require surgery and a serious disability. Yeah. So at that point I became interested in what that doctor was doing, and I decided then that chiropractic might be something I wanted to do. After I graduated from college, I was working for a real estate company, and was introduced to a chiropractor up in Woburn, a gentleman by the name of Dr. Mark Moore-Marco, who was a fabulous chiropractor. And I saw what he was doing, and that's when I decided this is exactly what I want to do.
It's you're bringing back a memory, a personal memory of many, many years ago, probably 20 years ago, 25 years ago. I was on vacation in Aruba and went to the location where we were staying for the week. And they didn't have an elevator, so I had to lift my luggage and bring it up to the second level, and somehow threw my back out. It was really very painful. I went to the hospital and they gave me two choices. One was to be in traction for a week, which didn't sound like a very appealing way to spend the week's vacation. Or the other one was to see, I believe he was a physiotherapist, and I chose that one. And I was amazed that the pain disappeared when I was treated by that particular person. I believe he was a kind of a chiropractor. Does that sound right?
Yes.
So I learned to love that kind of treatment whenever I had a back problem.
Yeah.
It was, all you're doing is putting things back the way they should be.
Yeah, at the end of the day, it's pretty simple. It's mechanical.
That's it.
Yeah.
How much schooling do you need to become a chiropractor?
So I graduated from the University of Massachusetts, obviously a 4-year degree, and then the chiropractic program is a 5 academic year program. 4 years of classroom study, synonymous with medical school, the same courses, we take all the same courses, and then a 1-year clinical internship. So 5 academic years, so it's 9 years of schooling after high school.
Really?
Yeah. I was able to go to school through the summers during my graduate school, during chiropractic school, so I was able to compress it into 3.5 years instead of extending it out a normal school year being September through May. I added an additional semester in every year from May through September. So I finished in 7.5 years.
Amazing.
Yeah, yeah, it was quite a lot of schooling. It's a lot of schooling.
But it was worth it.
Well worth it. Well worth it.
Do you go back at all for refresher costs?
Yeah, every year in Massachusetts we're required to take additional continuing education courses each year to stay up on the latest current trends in chiropractic and in medicine in general.
What is your clinical philosophy of care? Because my understanding is a lot of people believe that all chiropractors want to treat endlessly.
So I'm a little bit different than most chiropractors in that I'm trying to get people better as quickly as possible and get them back to their life as quickly as possible so they don't need to be coming into my office constantly. I'm not looking to put people on extended treatment plans endlessly. So my clinical philosophy is treat each individual separately and as quickly as possible and get them back to living their life without again, the myth that once you go to a chiropractor you have to go forever. That's not the case at all. In my practice, we really focus on the philosophy of get them in, get them better, and get them back to their life.
And hopefully they won't have to repeat.
They won't have to repeat. Now there are some patients, and I have many patients who love coming in for regular what we call maintenance care.
I was going to ask you about that.
Yeah, they come in for regular maintenance care. They want to be at the peak of their abilities all the time. So they come in once a week, twice a month, and I'm happy to do that for those people. But for the patients who come into my office with acute care problems, ruptured discs, sprained necks, sprained knees, those patients, we're treating them aggressively, get them in and get them out.
Okay. What conditions do you see mostly, or is there a variety?
It's a variety. I would say the vast majority of the care that we provide would be for neck injuries, back injuries. Headaches are a big component of my practice. Ruptured discs is probably the number one condition that I treat. And beyond that, we treat every moving joint in the body. So as a chiropractor, we're not only limited to the spine. We treat knee injuries, hip injuries, shoulder problems, rotator cuff problems, tennis elbow, golfer's elbow. We treat it all. We use a combination of chiropractic treatment, which is hands-on manipulative therapy, along with physiotherapies, including your typical physical therapy stuff, ultrasound, electric stimulation, exercise therapy, heat, ice. Cold laser is one of the newest therapies that we're using right now that we've had incredible results with.
I notice in your office you have a lot of gym equipment.
Yeah.
What do we do with that?
So the gym equipment and the rehab portion of our practice is really dedicated to taking patients who have acute injuries and trying to strengthen their muscles so that as they go forward, they don't have recurrences of the injuries as frequently. So we're trying to get people to get better for the long term as opposed to the short term.
One thing I learned about you, which I didn't know, is that you also are the chairman of the Mass Board of Chiropractors.
Yeah.
Tell us about that.
So in 2016, I was appointed by Governor Baker to be on the Massachusetts Board of Chiropractors, and then I was voted the chairman of the Board of Chiropractors in 2018. And the Board of Chiropractors is really there to protect the public. We're there to make sure that the chiropractors in Massachusetts, which range anywhere from 2,500 to about 3,000 chiropractors, are practicing within the standards set forth by the rules, regulations, and laws of Massachusetts, as well as federal law. So we're handling all the complaints that come in from the public, from insurance companies, and trying to enforce the laws of Massachusetts to protect the public from any chiropractors who are not practicing the way they're supposed to be.
Okay, so once you graduate from school, then you have to apply for a license?
Yeah, so to become a chiropractor in the United States, you have to have passed the National Board of Chiropractic Examination, which is a 4-part test. Then most states have a state licensing exam that you have to pass.
Is that a one-time?
And that is a one-time test, and then you're licensed in Massachusetts. And then in order to keep your license in Massachusetts, you have to continually be taking continuing education courses every year to maintain your license.
And most, I would assume, do keep their licenses up to date?
Most do.
Most do.
Yeah. There are occasions where they don't, and that's where the board comes in to investigate those situations and take disciplinary action when necessary.
Oh, a lot of responsibility.
Yeah, it's serious. It's serious work. It's not something that I take lightly. When you're controlling somebody's financial destiny,
Sure.
because if you revoke or suspend their license, they can't practice, and that's serious business.
Of course.
Yeah, it's serious business.
But if you revoke the license, there's a reason for it.
Yeah, we don't revoke or suspend licenses.
Because you don't like someone.
Exactly. No.
You revoke it.
There has to be a very, very serious, serious reason to do that.
Interesting. So when you have time to do that with all of your different offices, you have 5 days of work to do, and plus the
Yeah. So my clinical
plus the
practice,
board?
my clinical practice is primarily Monday, Wednesdays, and Fridays. That's when I'm seeing patients on Mondays, Wednesdays, and Fridays. Tuesdays and Thursdays are my what I would call executive function days. Those are the days where I'm running the 5 offices, doing the business end of the practice. And in the evenings is when I do my Board of Chiropractors work. That's when I do that. Keeps me busy. Keeps me busy.
Oh, wow. I didn't realize that about you. I thought you were just a chiropractor. What are the forms of therapy that you incorporate into your treatments? I mean, I'm asking you what I already know, but that's a question that we want to...
Right. So the primary form of therapy for chiropractors is spinal manipulation, which is using our hands to manipulate what are called subluxations. And subluxations are joint dysfunctions throughout the spine or any joints in the body that can affect how the nervous system works, the muscular system works, and in fact all systems of your body. So the primary application of spinal manipulation is what I use in the practice of chiropractic, along with supportive therapies, as we discussed earlier, exercise therapy to strengthen the muscles so that the problem doesn't keep coming back. and acute care pain treatments, which would include electric stimulation, cold laser therapy, ultrasound therapy, traction, those kinds of things.
You do all that?
We do all of it. So we do a combination of chiropractic care and physiotherapy combined in our practices.
And it works?
It works great.
For most people?
Yeah, for most people. There's obviously those patients who do require surgery, but I would say that in the vast majority of the cases that we see, we're in the less than 5% of my patients require surgery.
Well, I'll tell you, from my knowledge of chiropractic care, which goes back 30 years, 25 years, I'm a believer.
Yeah.
Just putting everything back in where it's supposed to be, and hopefully it stays.
It always amazes me when patients come into my office and they'll tell me at the outset, I don't really believe in chiropractic care. And I'll be amazed by that. I'll say, what do you mean you don't believe in it? And they say, oh, I think it's all hocus pocus and, quackery.
But they come into you?
They come into me. Their wife has forced them to come in, or somebody referred them and said, you have to go see this guy. Yeah. And in short order, it's one of the best feelings where after a week or 2 weeks of therapy, they're feeling better and they say, wow, I was wrong. It really isn't. It isn't quackery. It isn't. It's real stuff.
It works.
It works. It does work.
Amazing. Okay, we're going to take a short break to tell you about our sponsors, and we'll be right back. Hi, this is Roy Cohen. The crew would like to thank Maxie's Delicatessen, located at 117 Sharon Street in Stoughton. You can reach them by calling 781-341-1662. The American Cancer Society is looking for volunteers to drive cancer patients to and from treatments. You can volunteer by calling 1-800-ACS-6662 or online at www.cancer.org. Ilsa Mock's Food Pantry and St. Anthony's Free Market is located at 2 Park Avenue in Stoughton. For more information, call Christine Gallagher. That's 781-341-0611 or 781-341-0549. To get involved with Meals on Wheels, call Jessica at 781-344-8882, extension 2. The Stoughton Penny Saver. Our business is advertising your business in Stoughton. To advertise, call 781-344-4833. Community Forum showtimes here in Stoughton. You can see it on Thursdays, Fridays, Saturdays, and Sundays at 6 p.m., Monday at 8 p.m., Tuesday at 5 p.m., either on Comcast Channel 9 or Verizon Channel 28. If you have any comments or suggestions, contact us at communityforum1@yahoo.com. Samaritans, 41 West Street, 4th floor in Boston, Massachusetts, 02111, or call them at 617-536-2460. The 24-hour helplines, 877-870-HOPE or 877-870-4673. Samaritans, 800-252-TEEN or 800-252-8336, or online www.samaritans.hope.org. For you bingo players, I want to tell you about the Monday night bingo being held at the Ahava Torah Congregation, 1179 Central Street in Stoughton. The doors open at 4:30 p.m. The games start at 6:30 p.m. You come on down and win some money. They have 2 big prizes. One is $1,199 and the other one is up to $3,000. So come on down. Okay, we have some information, specific information where you can find the chiropractic office. The first one is the one in Southeastern called Spinal Rehab Group, LLC. They're located at 111 Belmont Street in Southeastern. Telephone number is 508-238-4878, or you can look online at www.spinalrehabgroup.com. They're open in that particular office Monday, Wednesdays, and Fridays from 12:30 p.m. to 2:30 p.m. and Tuesdays and Thursdays from 9 a.m. to 6 p.m. So just give them a call. And we also have the office that I'm very familiar with, the Chiropractic Health Group, PC. They're at 95 Washington Street, Suite 416, right by the stairway that goes downstairs. I guess you could describe it that way. And that's in Canton. Telephone number is 781-575-0100. And online it's www.chiropractichealthgroup.net. And in that office, they're open Monday, Wednesday, and Friday from 7:45 a.m. to 6 p.m. and Tuesdays and Thursdays by appointment. And I can tell you that if you need care, they can usually get you right in as soon as you're hurting. So give them a call. And we're back. We got some more questions for Dr. Dodes, and again, welcome to the show.
Thank you.
We need to talk about the misconceptions of chiropractic care. And basically, I'm asking a question, although I know the answer, but I want you to say what it is. Is chiropractic care safe? Because a lot of people are scared to go to chiropractors, and I've heard this in the past. I don't believe in what they do.
Sure. So chiropractic care is extremely safe. There are numerous studies that have shown that over the years. And unfortunately, every year we hear about some case somewhere in the country where a chiropractor treats a patient and the patient has some kind of serious reaction to the treatment. And ultimately, chiropractic gets blanketed as something that's not safe. In fact, chiropractic care is one of the safest of all healthcare professions. And the real way that you can determine the true risk of any medical procedure, whether it be chiropractic, dentistry, medicine, surgery, whatever it is to look at what the provider or the physician pays for their malpractice insurance. Because the malpractice insurance companies are not stupid. Their actuaries and their bean counters figure out what the real risks are for all the procedures that are performed. So, for instance, for surgeons, many surgeons can pay up to $50,000 to $100,000 a year for their malpractice insurance because the risk of a serious complication or even death is very high. And so the malpractice insurance companies have figured this out, and they're required to charge in proportion to the risk that provider performs, the procedures that they perform. For chiropractors, the risk is so low that most chiropractors, including myself, have insurance premiums for the same coverage that all doctors in Massachusetts are required to have. My malpractice insurance premium for this year is $1,300.
That's it.
$1,300 for the same coverage that all providers in Massachusetts are mandated to have. So you can see that the real risk of the procedure is very, very low. It's actually 1 in millions that anything serious would happen to you in a chiropractor's office. You're much more likely to have a serious medical reaction to taking Tylenol or Advil than you would to coming into a chiropractor's office.
Is there anything that a potential patient can, anywhere they can check to see the malpractice list? Is there such a thing?
I don't believe there's a registry of malpractice that exists for patients to look up. You can investigate each particular provider. So every chiropractor in Massachusetts, if you Google their name, you can get background information through the Massachusetts Board of Chiropractors website as to any malpractice claims made against their license. So you'll know whether somebody has multiple claims, which would be a red flag. But as the chairman of the Board of Chiropractors, we're notified every month of all the malpractice claims that come in against chiropractors in the state of Massachusetts. And in the past 4 years that I've been on the Board of Chiropractors, we've had less than 5 malpractice claims in total. So it's very, very rare that chiropractors are performing any kind of procedures that are really negatively impacting patients.
Is chiropractic care covered by insurance?
It is. It is.
It hasn't always been, has it?
It hasn't always been. And over the last 30 years, chiropractic care is universally covered by insurance now. Blue Cross, Harvard Pilgrim, Tufts, all the auto insurance companies cover chiropractic care. Workers' compensation is completely covered by chiropractic care. And in fact, you don't even need to go to a medical doctor to come to a chiropractor in Massachusetts. Chiropractors are considered primary portal of entry.
Oh, nice.
Portal of entry physicians, so you don't need a referral from a medical doctor to come into chiropractic care, which is different than it used to be. Years ago, many times you needed a referral to come in.
What about Medicare? I don't think you mentioned
Medicare completely covers chiropractic, and as Mass Health as well. Mass Health is covered, Medicare is covered. So for any patient with health insurance, you'd be covered for chiropractic treatment.
Okay, you have 60 seconds to tell us what you like most about what you do and what you do not like.
The thing I like most about being a chiropractor by far, it stands out immediately in my mind, is helping patients who come in with serious pain conditions, who are frightened that their life is going to be ruined by this and it's never going to get better. And helping those patients through that process without surgery, without long-term disability, is the most satisfying part of what I do. To get hugs from patients, you know, after their excruciating leg pain or back pain or neck pain is going away or gone, and I can say to them, you're discharged, you're done, you don't need to come back, is the best feeling of what I do. That's why I do what I do.
So we have to give you a hug when we're back.
You have to give me a hug.
Okay.
The worst thing about what I do is, unfortunately, when I have to, when I've had the patient who I had to tell them that they have a serious diagnosis, cancer or ALS or something much more serious than a simple neck and back pain, and that they're going to need to go to a different provider for treatment, and that I can't help them. That's devastating.
Okay.
That's devastating.
Well, we thank you very much for coming in.
My pleasure.
About
always a pleasure.
Chiropractic Care.
Thanks, Roy.
And very quickly, I would like to thank the following: Mike Hammond, Jeff Pickett, CJ Mullen, Dave Young, Gina Co. for coming in to direct, and we wish Leo McGowan good health, and hopefully he'll be back very soon too. This is Roy Cohen saying thank you very much for watching, and hope you enjoyed it.
Great.